31st. Be listening for complete coverage of the 1982 National Sports Festival on your station for sports, WIRE.
This is Sunday Indianapolis, public affairs presentation of WIRE Radio, with an in-depth look at issues and topics important to the Indianapolis community. I'm Pam Reesmeyer. Stress is becoming a major part of daily life in the United States. Reporter Ken Owen says a local Indianapolis hospital wants to help people learn to cope with added pressure.
The St. Vincent Stress Center opened last Sunday. It was developed to help patients, and in some cases their families, deal with the stress involved in being ill. The center treats three types of patients: those who are chemically dependent, such as alcoholics, those who are mentally ill, and those with terminal illnesses. The administrator of the Stress Center, James Schmidt, says a lot of planning went into the facility's development.
Basically, the Stress Center has evolved over about a 10-year period. It's a 112-bed acute psychiatric hospital, one of a kind. No other such animal in the country, or literally the world. Has 60 acute psych beds, 40 alcoholism beds, and 12 hospice beds. Really, the idea came together about 4 or 5 years ago. Went through the planning process, and the last 3 years have been in program development and in the construction phase of the project. I think the facility we have is an extremely unique facility, and I know no other hospital that is built along the lines of the Stress Center.
The environment at the Stress Center is far from institutionalized. There are no nurses' uniforms, steel bed frames, or cold tile floors. Schmidt says part of the rehabilitation process for the chemically dependent and mentally ill involves keeping them from withdrawing from society. He says the Stress Center is built around the concept of family, which is especially important when dealing with the terminally ill.
In setting up our hospice program, we literally had staff visit hospice from coast to coast. One of our staff went to England, went to France, looked at hospice there. Spent a lot of time talking with family members, spouses of people who had died of terminal illness. And out of those discussions grew a concept and an idea and a facility in terms of the kind of care, so that you'll find in our hospice program private rooms with a height of chairs so spouses can remain if they would like. You'll find a kitchen. You'll find a family room with a wood-burning fireplace. You'll find children's play areas, preteen play areas, a number of patios and private spaces or spaces that people can be involved with other people.
Schmidt says it's important that families come together as the time of death approaches for a loved one. He says no matter what the illness, people need to feel needed, which is one of the foundations the Stress Center is based upon. This is Ken Owen.
In the next segment, a look at a new service to help cut costs on long-distance telephone calls. For Sunday Indianapolis, I'm Pam Reesmeyer.